ever attended. Next slide, please. So, spoiler alert, the answer to the question, can we eradicate child poverty and reduce health inequalities, is yes, we can. But the problem is we need to choose to do so. Eradicating child poverty and reducing health inequalities are not problems like eradicating cancer or curing cancer or stopping climate change. It requires no scientific advances or new technology to do so. We know how to do it, and we can afford to do it. So I'm going to start with the good news, and then unfortunately I'm going to have to move on to the not so good news. Next slide, please. Okay, the idea that poverty can be ended is 230 years old. It was first proposed by the Marquis de Condorcet and was part of the many revolutionary ideas in France at the time of the French Revolution. And he published posthumously a book called Sketch for a Historical Picture of Progress of the Human Mind, in which he argued that poverty was not a result of God's will or bad luck or divine laws, but due to the present imperfection of the social arts. He argued that poverty could be ended by what we nowadays call welfare state solutions through the provision of pensions, grants to the young, sickness benefit, and state-funded education. He was, many of his ideas were way ahead of their time. He believed that both slavery, the monarchy, and clericalism should be abolished, that women should have equal political rights with men, and that democratic societies could be achieved through rational rules and by the improvement of the population through making high quality education free. Unsurprisingly, he died in prison. Next slide, please. It's also the 100th anniversary of the first International Human Rights Agreement. In 1924, the League of Nations adopted unanimously the Declaration on the Rights of the Child. This was drafted by the founder of Save the Children. She went up a mountain in Wales and came down with this for the press. And this argued that children must be given the means they require for their normal development, both materially and spiritually, and that hungry children must be fed and sick children must be given health care, and that children must be the first to receive relief, that's welfare benefits in times of distress. So 230 years ago, the idea that poverty can be ended came about, and the solutions which we know work today were proposed. And 100 years ago, the governments of the world agreed that children should be given the things they need by adults in order for them to be developed normally, materially and spiritually. So these ideas have been around a long time. Next slide, please. Next slide, please. Okay, so the other important thing to understand is that all cultures have a concept of poverty, and that all politicians think that both poverty and ill health are bad things, that health inequalities are bad, that child and adult poverty are bad. Politicians from the far left to the far right and everyone in between agrees there should be less child poverty and less ill health. It is almost unthinkable to think that any politician anywhere would argue that their country needed more poor children or a sicker population. And here are some quotes from different countries. Poverty is often equated with violence and crime and a great evil. Next slide, please. So, there have been vast improvements during the 20th century and into the 21st century. If we look at global under 5 mortality rate, it has more than halved since 1990. In 1990, it was about almost 100 uh, children died before the age of 5 per thousand live births, and now it's fallen to under 40. So the rate at which young children are dying has been consistently falling. Next slide, please. The other good news is that, again, for almost 100 years, more in fact, the average years of schooling of the population has increased. This graph shows for both the world and for industrialized advanced countries and developing countries, the average years of schooling between 1950 and 2024 has been steadily increasing. In 1950, on average, the child in the world went to school for 4 years. By 2020, that had more than doubled. And the projections are up to 2040 that this will continue to grow. The number of years that on average that children spend in school will increase, and that the gap between rich and poor countries will narrow. So the 21st century, children live healthier on average and are better educated on average than at any time in world history. Next slide, please. The material circumstances of children and adults has also been improving slightly more slowly. This graph shows for a whole range of African countries in sub-Saharan Africa for which we have data, the improvements in housing quality that occurred between 2000 and 2015. Often the high rate causes of health inequalities for children, particularly young children, are the squalid living conditions, particularly in their dwellings. And as you can see, in many countries, the number of adults and children living in houses which are built with unfinished materials has been declining, and the number of adults and children living in improved housing conditions has been increasing. The purple shows the percentages in 2000, and the green shows the increase between 2000 and 2050. So, children are living longer, healthier lives and living in better living conditions. Africa is the place with the worst housing conditions for children. Next slide, please. The gap in earnings between men and women in most regions of the world has been declining. This shows for the various regions of the world between 1990 and 2015, 2020, women's share of earnings as a proportion of men's share of earnings. If these trends continue, we will only have to wait another 130 years before the gender pay gap is closed and women on average are paid the same as men. So progress is being made, even in this. Women and men will reach pay equality, but progress is slow and in reverse in China, unfortunately. Shortly, Europe will catch up with where China was in the 1990s. Next slide, please. Extreme poverty, as measured by the World Bank, has been declining since the 1980s. Although obviously it has risen most recently during the COVID pandemic, but by and large the trend is down, both in terms of the percentage of the population of the world that's living in extreme poverty, and also the actual absolute number of people. So in 1981, the World Bank estimated that about 45% of the world was living in extreme poverty. That's now under 10%. And it was almost 2 billion people in 1980. And now it's under 1 billion, according to the World Bank. Next slide, please. The world also has a plan. In 2015, the governments of the world came together and agreed that their first goal in the Sustainable Development Goals was to eradicate poverty and leave no one behind during the 21st century. They also committed to reducing hunger and also improving health, and making healthcare universally accessible. There were 17 Sustainable Development Goals agreed with 169 targets and 232 indicators. So the governments of the world have now agreed, as they did 100 years ago, but with more specific targets this time, to eradicate poverty during the 21st century. If they manage to achieve this, this will be one of the greatest achievements in human history. Next slide, please. Well, I wish I could stop my talk now, but unfortunately, I have to give you some bad news. Next slide, please. The latest UN report on progress on the Sustainable Development Goals does not make happy reading. Only 15% of all those 17 goals and all those targets, 169 targets with 230 indicators, only 15% are on track. 85% are off track. If we look at goal one, none of the targets are on track. That goal one is the eradicating poverty. If we look at goal two, reducing hunger, the overwhelming majority of targets are off track, and the same for goal three of improving health. So, the Secretary General of the United Nations, at the end of last year, said, unless we act now, the 2030 agenda will become an epitaph for the world that might have been. If the current trends continue, at least 575 million people will still be living in extreme poverty by 2030. The commitment was that should be zero by 2030, and that poverty using a higher threshold should be eradicated before the end of the century. The number of people facing hunger and insecurity has been rising since 2015 for almost 10 years. There are now 45 million children under the age of 5 who suffered from wasting, and almost 150 million are estimated to have stunted growth. Childhood vaccinations have experienced their largest decline in 3 decades, partly as a result of the pandemic. Tuberculosis and malaria deaths, which are major killers of children, have increased, and there are almost 400 million people who have been pushed into poverty or further into deep poverty in 2019 before the pandemic due to out-of-pocket payments for healthcare. Healthcare is still not universally accessible and affordable. Next slide, please. Although the World Bank shows a decline in the numbers in extreme poverty, other UN organizations, the United Nations Secretariat, have less optimistic forecasts. And the latest forecast from the UN Secretariat is that by last year, there will still be 865 million people living in extreme poverty, slightly more than there were in 2015. So the pandemic resulted in all progress in reducing extreme poverty being lost on these estimates. It certainly slowed down. Next slide, please. If we look at the World Bank's estimates specifically for children under 18, they do show a slight decline since 2015, but still the latest data we have for 2022, they estimate that 333 million globally, about 1 in 6 children on the planet, are still living in extreme poverty, and that children are more than twice as likely to be living in households which are extremely poor than adults, and not be able to afford, households which can't be able to afford food, sanitation, shelter, healthcare, and the education that children need. Next slide, please. So what would it mean if the world were to suddenly accelerate its delivery on the SDGs and manage to eradicate extreme poverty by 2030? That would certainly be a good thing. Instead of there being 333 million children living in extreme poverty, there would be 0 and 0 adults. But the extreme poverty line is set very, very low. And if everyone in the world was on or above the extreme poverty line, this would mean that still 14% of children would be estimated to die before their fifth birthday. And of those children that survived, 40% would be stunted and another 30% would be underweight, or stunted and underweight. This shows really the inadequacies of the international extreme poverty line for children, and particularly for children's health. Next slide, please. So what is it that kills the poorest children? How does the poverty kill them? Well, it's just from a few main causes. Neonatal disorders, diarrhea, pneumonia, malaria, and to a lesser extent, measles. The green lines on this graph, about half of the under 5 child deaths, while where malnutrition, being underweight, contributed to weakening the child's immune system and contributed to their death. All these conditions are easily treatable. A large number of the neonatal disorders deaths could be ameliorated if there was adequate care during pregnancy and childbirth and after pregnancy. No new technology is really needed to prevent diarrhea or pneumonia or malaria in deaths. We know how to do this at relatively low cost, at $1 or $2. The problem is that the living conditions of the children and the poverty of the household and the lack of medical care means children don't get the care they need in order to survive. Next slide, please. What are these living conditions? Well, I'm comparing here 2000 and 2010. In 2010, almost a third of the world's children lived in squalid living housing conditions, 5 people per room, mud floor. Over 500 million children, about 1 in 4, had no toilet facilities whatsoever. About 1 in 10 were drinking from unsafe water sources or had to move water so far they couldn't collect the minimum necessary easily to maintain health. Similar numbers lacked access to information sources, and about 1 in 15 children were severely educationally deprived of school age that never set foot in school. The items marked in bold are the ones where there has improvement between 2000 and 2010. This is where most of the world's policies have been concentrated on improving health and education access, to a lesser extent on improving access to safe water, and also technology has moved on and the cost of getting information has been reduced. The other 3 items, housing conditions, toilet facilities, malnutrition, have improved only slightly, at much slower rates. There have been improvements in all these areas, but the improvements are where policy has been concentrated, whereas tackling sanitation or living conditions, there hasn't been the same policy effort. But there could be. These things we know how to do. Next slide, please. Just to try and understand the difference in living conditions in low income, middle income and high income country. Here I've given examples of the kind of deprivation that children suffer in Uganda, which is a low income country in Africa, Tonga, which is a middle income country, a small island in the South Pacific, and the UK, which is a high income country in Europe. And you don't need to do any sophisticated statistical analyses. These are just the raw percentages of the percent of children who go without these different deprivation items because their parents cannot afford the children to have them. Just to say that the overwhelming majority of parents in all these three countries believe these are necessities for children that all children should have, and no children should have to go without. So in Uganda, about half of the children, their parents cannot afford to give them 3 meals a day. In Tonga, it's 8%. In the UK, it's 1%. Again, similarly, in Uganda, 7 out of 10 children, their parents can't afford to buy them properly fitted shoes. Tonga, 12%, and scandalously in the UK, it's 4%. 70% of children in Uganda don't have celebrations on their birthdays or special occasions such as Christmas. Again, it's 17% in Tonga, 1% in the UK. You don't need a PhD in statistics or research to understand the difference in living conditions. Next slide, please. However, this does not mean that although poverty is less severe for children in rich countries, such as the UK or Canada, that child poverty in these countries does not have bad outcomes. Children tend not to die before their fifth birthday in large numbers like they do in developing countries, but nevertheless, reviews of the evidence in rich countries show that poor children tend to have poor health outcomes. They have worse mortality. There's a higher, strong association between childhood poverty and mortality. They have worse morbidity. They have a greater number of fatal accidents, mental illness, suicide, teenage pregnancies, homelessness, poor living conditions. Interestingly, the evidence doesn't show that poor children are more likely to have bad behaviors compared to their richer peers. They're less likely to commit crimes, or just as likely, they're less likely to abuse alcohol or drugs or work illegally in child labor. This is in rich countries, not poor countries, or to smoke during childhood. They simply can't afford to do these things. Next slide, please. There have been long-term trends in the rich countries in the pattern of poverty. This graph shows the rates of low-income poverty in the OECD countries, the rich countries, Europe, North America, Japan, Taiwan, the wealthy countries in the world. In the mid-1980s, the group which was likely to be poorest were the over 75s and the 60, those aged 66 to 75, basically retired people. There were higher rates of poverty in childhood under 18 and slightly lower for youth 18 to 25, and the lowest rates were with working age between 26 and a retirement age of 65. Next slide, please. These patterns have changed over the past 40 years. Poverty amongst older people has declined, which is a very good thing, but the poverty rates amongst children and amongst young people in particular, 18 to 25-year-olds, have increased dramatically, as have the poverty rates amongst those of working age. So there's been a long-term shift over the past 40 years, with poverty being higher in old age, and that has declined, but simultaneously poverty, particularly for children and young people, has increased, and now children and young people are the poorest groups in the rich countries in the world. Next slide, please. This shift has in part been caused by since the age of neoliberalism and Thatcher and Ronald Reagan's election, there has been a long-term shift in inequalities at a global scale, with the richest, particularly 1%, capturing more and more of the planet's wealth. If we look between 1995 and 2021 at global inequality, uh, the poorest 1% captured about 38% of the global wealth, and the poorest half of humanity captured only 2% of all that growth over those 26-year period. The richest 1% own more wealth than the whole rest of humanity put together, according to Credit Suisse. And there are many statistics produced by organizations like Oxfam, which show that the world's 10 richest men own more wealth than the poorest 40% of humanity. A few years ago, the House of Commons Library, that's the legislature in the UK, did some analyses and argued that if the trends which occurred before the pandemic continued, by 2030, the richest 1% would own 2/3 of the wealth of the planet. Those trends have accelerated since COVID. And it may well be before 2030 that the richest 1% become the owners of 2/3 of the global wealth. Next slide, please. And that's just what the latest data has shown. During 2021, the capture of global wealth by the richest 1%, the richest 80 million people, has accelerated. And in 2020 to 21, they captured about 63% of the global wealth. The bottom 90% of humanity captured only 10% of that wealth, and that was a high gradient. Next slide, please. The pandemic, of course, had a devastating impact on the economies of the world. If you look at the cumulative loss of gross domestic product by the regions of the world compared to the pre-pandemic projections, you see that in Africa, for example, in last year, the cumulative impact of the pandemic was about a 20% decline in GDP, and in South Asia, it was even greater, a 35% decline. Many of the policies for reducing child poverty and improving healthcare were based on the assumption that the GDPs in these regions would continue to grow. Instead, although it has shrunk in some places and certainly not grown at the speed at which it was expected before the pandemic. Next slide, please. When the pandemic broke out, the chief economist of the International Monetary Fund and his team did a quick analysis on the long-term or medium-term impacts of the previous epidemics and pandemics that had occurred during the 21st century. They looked at SARS, H1N1, MERS, Ebola, and Zika at the 64 countries that were most affected by these disease outbreaks. And looking at the top 10%, that's the top left-hand graph, at time zero, when the pandemic or epidemic was occurring, you found that the richest 10% saw a small rise in their income, about 1%. If you look at the graph on the bottom left, the poorest 10% saw a relatively small fall in their income, about 3 or 4%. However, over the 5 years following the end of the pandemic or epidemic, the rich saw their incomes continue to grow by about 6%, and the poor saw their incomes begin to fall more rapidly by about 12%. So inequality continued to grow for 5 years following these major outbreaks. This is due to the kinds of policies that governments tend to then follow after the outbreak of major disasters. The IMF argued that if governments pursued the policies, business as usual, then we would see a growing global inequalities following the much larger COVID-19 epidemic. And that's exactly what we have seen. And that's exactly what's playing out now. And this is true whether you look at the top and bottom 10% of the income distribution or the top and bottom 20%. Next slide, please. Another major long-term problem for eradicating poverty and better funding of healthcare is climate change. There is now more CO2 in the atmosphere than there has been for the past 3.5 million years. And the past year has been the warmest on record. This shows the sea surface temperatures daily between the yellow line is 2023. The red line is what's happened in 2024. And the dotted line shows the average between 1999 and 2020. We are now about 1.6 degrees above 1.5, 1.6 degrees above the pre-industrial average. We've passed the 1.5 degree mark. And that may fall, but at the moment it doesn't look like it will. Next slide, please. One of the problems with this is that climate change is predicted to have a major effect on the global economies. This top left-hand graph shows the anticipated decline in income per person on the planet due to climate change between now and the end of the century. The blue line is the decline that would occur if we were to adopt all the policies necessary for the 1.5 degrees that we've already reached to be maintained and not exceeded. That's very unlikely to happen. The red line is what would happen in terms of GDP income per person if we continue to burn fossil fuels and increase greenhouse gas emissions at the current rate. That's also unlikely to happen. So what's likely to happen is somewhere between the two. So we're probably looking by the end of the century at a 40% decline in income per person. That's larger in sub-Saharan Africa and Asia than it is in Europe or North America. The map on the right is from another paper published in Nature recently showing the estimated reduction in GDP, that's the overall wealth, not per head, that would occur from 3 degrees of global warming. We're at 1.5. We would probably reach 3 degrees of global warming by the end of the century. And in every country, almost every country in the world, there would be a decline in GDP, even where there's population growth. The one bright example where there would be an increase in GDP is in Iceland. So if you're advising your grandchildren or great-grandchildren where to go and live, Iceland's looking pretty good for the long-term prospects. But the amount of money per person that we are likely to have if current trends continue in order to eradicate poverty and improve health is likely to decline due just to climate change. Next slide, please. We know how to reduce inequalities in health. The WHO, World Health Organization Commission, Michael Marmot and colleagues in 2008 said the things the world needs to do is improve the conditions of daily life, the circumstances in which people are born, grow, live, work, and age, particularly reducing child poverty, tackle the inequitable distribution of power and money and resources, reduce the levels of inequality that are accelerating at the moment, and also do more research and measure the problem. Next slide, please. This shows the kind of things what I believe and my colleagues believe at Bristol we need to do to reduce health inequalities. In 25 years ago, there was a report on the CRCHUM report on reducing inequalities in health in the United Kingdom, and the then chief medical officer for England gave in the government's reply to this his top 10 tips for better health. He argued you shouldn't smoke, you should follow a balanced diet, keep physically active, manage stress, drink alcohol in moderation, cover up in the sun, practice safe sex, take cancer opportunities, be safe on the roads, and learn about first aid. And these are all excellent suggestions on how to improve individual health, and I hope everyone will follow them. but they have virtually nothing to do with reducing inequalities in health. In fact, this kind of public health advice has been shown in some cases to increase inequalities in health because the richer people are able to adopt these things, sometimes particularly better diets, than poorer people. So we gave an alternative top 10 tips on how to reduce health inequalities. Don't be poor, don't live in deprived areas, don't be disabled or have a disabled child, don't work in stressful jobs, live in better housing, be able to afford leisure activities, etc., etc. Those are the kinds of problems we need to tackle to reduce health inequalities, to reduce the poor living circumstances that poor people and households live in throughout the world, and which are the drivers for health inequalities on a global scale. Next slide, please. Okay, so we know the solution to ending child poverty. We have known the solution for several hundred years. The economics of adult poverty are complex, but the economics of child poverty are very simple, and they're entirely to do with redistribution. Where sufficient resources are redistributed from adults to children, there will be no child poverty. Where insufficient resources are redistributed from adults to children, child poverty is inevitable. Children cannot and should not be doing paid work to generate the resources they need to escape from poverty. This is the job of adults, the job of their parents and of other adults in their societies. Children should be spending their time playing and learning, not working in paid labour, earning money. We know how to end child poverty. We have the resources, we have the knowledge. We also know how to reduce inequalities in health. What is lacking is the political will. Thank you very much.
Any questions, comments, reactions? Yes, please. I suggest that you name who you are because Dave cannot see you.
Hi, Dave. Lynn Kemp from Sydney in Australia. Okay, the curly question for all of us is how, given where politics, at least in the industrial developed countries, seems to be going at the moment, except for perhaps I think you're going to have a change of government shortly. How do we change, any tips? How do we change the political will? Because I think that's been the issue for at least since the 1970s and the neoliberalism. I mean, how do we change it, particularly when you think about what's happening in at the US and the rise of the alt-right, and the increasing power of these very limited elite that are actually now controlling government?
Okay, that's a very important question. Yeah. As I showed, the policies that seem to be based on ever expanding economic growth, that's probably not going to happen, at least not at the same rate in the past. There has, since the 1980s, been a capture, ever increasing levels of capture of the global wealth, which has been expanding by a narrow group of people of the top 1%, or to a lesser extent, the top 5%. But certainly in the rich countries of the world, most are democracies, and people have the ability and the right to vote and to change the way that taxation is done. At the moment, there's a lot of tax in all countries on income, particularly earned income, and very, very low taxes or almost no taxes on wealth. And there are a whole series of tax havens where trillions are stored, achieving no good at all. We can tax wealth at the same rate as income. There's no thing stopping that. And indeed, there's beginning to be moves at the United Nations. It's been taken away from the OECD to begin to have minimum rates of tax on income and wealth. And if the UN manages to push that through, it tried once 30 or 40 years ago and it didn't succeed. But the money is there. It's not a question that we can't afford it. And the pandemic showed that Keynes was probably right, that when emergencies happen, that a society can afford to do anything it can do. At the end of the day, it's important to always remember that money doesn't really exist. It's just an idea. There's no such thing as money. It's numbers in a computer or a promise on your banknote from someone you've never met and never will meet. Humanity can afford to do when a crisis occurs anything it can do, and we can redistribute sufficient resources to children to stop them being poor. We know how to do that. We have welfare state solutions that were first suggested 230 years ago, and we know that they can be effective. We know how to, that reducing, eradicating poverty will have a major effect on reducing inequalities in health and reducing inequality per se. Our next speaker, Kate, will tell you, will also have an effect on reducing health inequalities. So we know how to do it. It's a question of political will.
We have time for one brief question, and then we're going to go on to our next speaker. And I see that some people have joined us. Hello, Jody. Hello, David. So thank you for being with us. And so we have a question. Sylvana, s'il vous plaît, ton nom?
Sylvana Côté from University of Montreal. Thank you so much for this very high level and disturbing talk. I'm concerned with child development, and when I see children as young as age 1.5 fighting for resources, fighting for their territories, trying to, they compete with each other, most of them, it's a natural thing to do. I really wonder if the redistribution notion is an utopia. I mean, I think it is going against human nature. I think we should absolutely go against our nature. That's why we're here at this point, because we have been going, we have been doing things that other animals do not do. I'm thinking about using arms and destroying the planet and all these kinds of things. So, but my question is, children growing up today will get us out of this or not? And how can we organize an education system that can support the notion of an equal society is the way to go, the only way to go? How can we help our children understand this so that they go against the current trends?
Okay, so again, a very important question. Education is key, and as I showed, things are getting better and are projected to continue to get better in terms of the average child in the world being at school longer and being better educated. The Marquis de Condorcet said this was a prerequisite for a better global society. Most countries, the birth rate is below replacement ratio now. There will be fewer children in the future, and hopefully that will mean that more resources will be sent to them, will be given to them by adults. The children of the future will be, in the longer term future, will be African or Indian. They're the countries which will have the children of the 22nd century. And I hope that those children will be more egalitarian and be more willing to share than European and North American children have been when they became adults. That is a long-term hope for the future.